Hi there, I'm Dr. Rajita, faculty of Next Fellow. So today we are going to discuss a little complicated and quite important topic, that is about the perineal pouches. So it is very important to have a proper orientation to understand these perineal pouches. So here we can see the perineal view of pelvis, that is the pelvic outlet you are seeing, which forms the anatomical boundaries, and here in living. So the perineal pouches, to understand, first the perineum is divided into two triangles. So the anterior one is the urogenital triangle, which is shown in pink color, and this green one is the anal triangle. So an horizontal line is drawn here separating these two triangles, which is the horizontal line connecting the anterior part of ischial spine. So this is the ischial spine. Here is the ischiopubic ramus, pubis, pubic symphysis. So here we can see in living, anteriorly the perineal region is bounded by the mons pubis, posteriorly the inferior border of the inferior gluteal line, and the structures traversing through the urogenital triangle are the urethra and vagina in females, and in posterior, that is the anal triangle, we can see the opening of anal opening. So in males there is no vagina, so only urethra passes through urogenital triangle. So what we are discussing about the superficial and deep perineal pouches. So these two pouches are located in the anterior part, that is in the urogenital triangle. So from the perineal view, if we remove the fascia here, the first space what you are going to see is the superficial perineal pouch, and after removing the superficial perineal pouch, there will be a membrane called as perineal membrane. When you retract the perineal membrane, you will enter the deep perineal pouch. So basic idea is the perineum is divided into two triangles, anterior urogenital triangle, posterior anal triangle, which are separated by an horizontal plane through the anterior end, drawn through the anterior end of ischial tuberosities. The urogenital triangle is traversed by urethra in males and urethra and vagina in females. An anal triangle is traversed by the anal canal in both males and females. So the urogenital triangle contains the superficial and deep perineal spaces. So let us understand in coronal section. So this is the coronal section taken at the level of urogenital region, that is the anterior part of perineum, where we can see internally urinary bladder and prostatic part of urethra, prostate and all. So here this muscle, the pink color one, is the deep perineal pouch, which contains here deep transverse perineal muscles, which forms the urogenital diaphragm, and the red line indicates the perineal membrane, which separates the deep perineal pouch from superficial perineal pouch, and the green line here, it indicates the superficial perineal fascia, deep perineal fascia, and this is the superficial perineal fascia. Superficial perineal fascia is nothing but the Colles fascia. So the gap between the Colles fascia and the perineal membrane would be the superficial perineal pouch, and the gap between the superior urogenital fascia and inferior urogenital fascia along with the perineal membrane is the deep perineal pouch. So on the surface, the urogenital triangle presents penis and scrotum in males and external genitalia, and in females external genitalia and orifices of urethra and vagina in females. And the triangular tough sheet called as the perineal membrane stretches across the triangle and it is attached to the sides. And the posterior margin of the perineal membrane is fused centrally with the perineal body. The perineal membrane is pierced by the urethra in males and by urethra and vagina in females. And above the perineal membrane, the urethra is surrounded by voluntary sphincter, that is urethral muscle, superficial urethra, and in females the superficial urethral sphincter is also pierced by vagina. And the membranous layer of the superficial fascia of abdomen. So abdomen superficial fascia has got two layers. The outer layer is called as the fatty layer or camphus layer, and the deep layer is the called as the membranous layer or scarpa, fascia of scarpa. So this superficial fascia, membranous layer of superficial fascia, which is otherwise called as fascia of scarpa or scarpa's fascia, it surrounds the penis as forming a tube-like facial sheath called as Buck's fascia, and it continues into the scrotum, and finally it fuses with the perineum and posterior edge of the perineal membrane. And in the perineum, the same fascia is called as Colles fascia. So in the abdomen, the membranous layer is called as Scarpa's fascia. Same Scarpa's fascia continues around the penis as the Buck's fascia, and it continues in the perineum as the Colles fascia. So hence the superficial perineal pouch is formed between perineal membrane and Colles fascia. The blue lining is the Colles fascia, which is the superficial perineal fascia. So let's talk about the superficial perineal pouch and its contents in detail. So here one side we are seeing the female perineal region, and this is the male perineal region. So in it lies, we know, between the perineal membrane, and the inferior fascia of urogenital diaphragm and Colles fascia, just now we saw in the previous slide, and it is an open compartment. This one, you can see here, this is the transverse perineal muscle, and this triangle is the anal triangle, this is urogenital triangle. This white color membrane is the perineal membrane, which is like a triangular sheath present on each side, and in the center it merges with the perineal body here. So this is the anterior side of pubis, this is the posteriorly sacrum and coccyx. So the contents are we can see the bulb of penis, root of penis, and crus of penis. Here the root of clitoris, crus of clitoris, and bulb of vestibule, and also greater vestibular glands. So these are the contents of the superficial perineal pouch. So this superficial perineal pouch, it is like an open compartment because anteriorly it freely communicates with the potential space lying between the superficial fascia and anterior abdominal wall muscles. Superficial fascia of abdomen, that is fascia of scarpa, and anterior abdominal muscles, that space, it continues with this superficial perineal pouch. And in males, the contents, the root of penis and superficial perineal muscles, and in females the root of clitoris, this is the root of clitoris, and along with the superficial perineal muscles. Let's see what are those superficial perineal muscles. In males, bulbospongiosus, which is covering the bulb of penis, is the bulbospongiosus. The ischiocavernosus muscle present on each side covering the crus of penis or crura of penis, crus of penis, and the superficial transverse perineal muscle, which is present on each side merging in the middle with the perineal body. And this superficial transverse perineal muscles we can see on each side running transversely from the perineal body to the ischial ramus. And in females, the bulb of vestibule, so the bulb of vestibule, it is covered by bulbospongiosus muscle, and crura of clitoris we can see on each side, which is covered by ischiocavernosus muscle, and superficial transverse perineal muscle, which is present on each side, extending from the perineal body to the ischial ramus. So these are the contents in males and females. So here is the coronal section demonstrating the contents of both superficial and deep perineal pouches. As of now, superficial is going on. We will see the superficial perineal pouch contents. So the root of penis, this is a male coronal section. So what you are seeing is the root of penis, where it is the bulb of penis covered by bulbospongiosis, and laterally ischiocavernosus covering the crus of penis. And apart from these muscles, we can see the ducts from the bulbourethral glands present in the superficial perineal pouch. We can see the ducts of bulbourethral glands, they pierce the perineal membrane here and opens into the urethra. That is the bulbous part of urethra. And that is one important thing. And branches of some internal pudendal arteries, which are called posterior scrotal vessels and nerves, and the arteries and the nerves are the branches of pudendal nerves. Posterior scrotal nerves are the branches of pudendal nerves, and also the perineal artery, dorsal artery of penis are the contents, and perineal nerve, dorsal nerve of the penis are the contents of superficial perineal pouch. Let's see the contents in females. Here is the coronal section of urogenital region showing the contents of superficial perineal pouch in females, and the crura of clitoris covered by ischiocavernosus present on each side, and superficial transverse perineal muscle and perineal body, round ligament of uterus, part of the round ligament of uterus, and we can see the glands here, which are called as greater vestibular glands or Bartholin's glands, which are present on each side of the vagina here. Within the bulb of vestibule they are present. And like males, here also the branches of internal pudendal arteries, which are called posterior labial vessels, and branches of pudendal nerve, which are called posterior labial nerves, and also the deep artery of clitoris, which is and also the branches of pudendal nerve like perineal nerve and dorsal nerve of clitoris. So all these are the contents of superficial perineal pouch in females. So now let us move on to this deep perineal pouch. So deep perineal pouch, if you look at this coronal section, the first area would be the superficial perineal pouch when you see from the perineal view. So in the perineum, the first pouch here is the superficial perineal pouch. After removing the collis fascia, that is superficial perineal fascia, we would enter into the superficial perineal pouch, and once you remove this perineal membrane, then the pink color area is the deep perineal pouch. Deep perineal pouch mainly contains urogenital diaphragm, which are the muscles of deep perineal pouch, containing deep transverse perineal muscles on each side. So we know the superficial transverse perineal muscles are the contents of superficial perineal pouch, and deep transverse perineal muscle are the contents of deep perineal pouch. And this deep perineal pouch, it is extends between superior urogenital fascia and inferior urogenital fascia along with the perineal membrane. So this pink color area is the deep perineal pouch. So let's see the contents in males and females. So the membranous urethra, we can see the membranous urethra crossing the urogenital diaphragm, in males. And one thing we have to note here, urogenital diaphragm should not be confused with the pelvic diaphragm. Urogenital diaphragm is present in urogenital region. Pelvic diaphragm is complete support of pelvis, which is formed by levator ani and coccygeus muscle. And here the deep perineal pouch, it mainly traversed by this membranous part of urethra in males, and the deep transverse perineal muscles, sphincter urethrae, which is present along the membranous urethra, and bulbourethral glands. One thing to be noted here, bulbourethral glands are located in the deep perineal pouch. Bulbourethral glands are otherwise called as glands of Cooper, and we can see the ducts pierces the perineal membrane to open into the bulbous part of urethra, that is in the superficial perineal pouch. So the opening is located in the superficial perineal pouch. The glands are located in the deep perineal pouch. And apart from these, we can see the branches of internal pudendal artery, which is called as the artery of penis, and branches of pudendal nerve, which is called dorsal nerve of penis. So these are the contents in males. Let's see the contents of deep perineal pouch in females. So in females, the perineal membrane is pierced by urethra and vagina, both openings. So the urogenital diaphragm is also pierced by vaginal opening and urethral opening. So here the coronal section is taken at the level of vagina. So we are seeing vaginal opening, which is on each side we can see the deep transverse perineal muscles and sphincter urethrae muscle. And in males we saw the bulbourethral glands or glands of Cooper as the content of deep perineal pouch. But here in females there are no glands. So no glands are located in the deep perineal pouch. The glands are located in the superficial perineal pouch. So this difference has to be noted. And branches of internal pudendal artery, that is the artery of clitoris, is present here, along with the dorsal nerve of clitoris, which is a branch of pudendal nerve. So these are the contents in females. So let's list out the differences in males and females, the contents of deep perineal pouch. So here it is traversed by membranous urethra, and here urethra along, and also it is traversed by vagina, and deep transverse perineal muscle, sphincter urethrae, here also same thing in females. Bulbourethral glands or glands of Cooper are present in deep perineal pouch in males, no glands in females. And branches of internal pudendal artery, artery of penis, and same thing arteries of clitoris, then branches of pudendal nerve, dorsal nerve of penis, dorsal nerve of clitoris in females. So these are the contents of deep perineal pouch in males and in females. So let's talk about this urogenital diaphragm, which is a muscular component of deep perineal pouch. So the term urogenital diaphragm should not be confused with the pelvic diaphragm. Pelvic diaphragm is a part of pelvic floor, which is a true diaphragm supporting the pelvic viscera. And pelvic diaphragm is described as a layer of pelvis that separates the deep perineal pouch from the upper pelvis. It separates from the, it is above the deep perineal pouch in the urogenital region, and it continues in the anal region as well, and it separates the pelvis from the perineal region. So that is the difference. If you want to know more about pelvic diaphragm, I have made an already one video. You can check out that video once on pelvic diaphragm as well. So here we can see this urogenital diaphragm, which is a muscular component in deep perineal pouch. It is when we reflect this perineal membrane, you can see. So one side you are seeing superficial perineal pouch. This is a female perineal region, because that too only urogenital region, and where we are seeing one side superficial perineal pouch, the other side deep perineal pouch. So superficial perineal pouch containing glands of Bartholin's or greater vestibular glands in superficial perineal pouch in females. But in males, the glands are located in the deep perineal pouch, which are bulbourethral glands. And once you reflect the perineal membrane, you can see this glands. And let's see the components. It contains mainly the external urethral sphincter. So this is the external urethral sphincter, and also it contains deep transverse perineal muscle. So this is the deep transverse perineal muscle. This is the deep transverse perineal muscle on each side, and here is the perineal body, which is located behind the vagina, posterior to the vagina. So the urethra and vagina pass through the urogenital diaphragm. Bulbourethral glands or corpus glands are among the fibers of the sphincter of urethra in deep perineal pouch in males. On posterolateral sides of the membranous urethra, the bulbourethral glands are located. And let's see the structures piercing the perineal membrane. So posterior scrotal vessels in males. So this is male urogenital region, and this is the female urogenital region, and we can see the structures passing from deep to superficial perineal pouch by piercing this perineal membrane. So the contents here in males are posterior scrotal vessels and nerves on each side at the base. You can see here on each side at the base, and posterior labial nerves and vessels in females, and deep artery of penis in males, and in females dorsal artery of clitoris and deep artery of clitoris. Here is the deep artery and dorsal artery, these things. And next, ducts of bulbourethral glands, which are important to be noted here. We can see the ducts of bulbourethral glands in males, but there are no such ducts in females. And here the ducts are associated with the artery, which are called artery to bulb of penis. Here the artery to the bulb of vestibule in females. And in females, both vagina and urethra traverses and pierces the perineal membrane. And in males, only urethral opening pierces the perineal membrane. So let us move little bit about the clinical aspects. So episiotomy is a surgical incision of the perineum, which is usually done along the posterior vaginal wall to enlarge the vaginal opening during the childbirth. So it is done during the second stage of labor to quickly enlarge the opening for the baby to pass through. So there are two types of episiotomies. One is the median episiotomy. So the median episiotomy is midline episiotomy, which is shown here. So median episiotomy, and which starts from the frenulum of the vaginal wall and proceeds frenulum of the labia minora and proceeds directly downwards, cutting through the skin of the vaginal wall, and it cuts the perineal body and superficial transverse perineal muscles, and medial, that is about the midline episiotomy. So it will cut the frenulum, then it will cut the perineal body and also superficial transverse perineal muscles. The next is the mediolateral episiotomy, which is shown here. The line is shown here, mediolateral episiotomy, and it starts at the frenulum of the labia minora and proceeds at a 45 degrees angle, cutting through the skin, vaginal wall and bulbospongiosus. So that was about the episiotomy. Let us discuss about the some questions associated with these perineal pouches. Superficial perineal space contains all except. root of penis, urethral artery, greater vestibular glands or Bartholin's glands, and membranous urethra. I hope you know the answer now. Membranous urethra, because we know the membranous urethra is a content of deep perineal pouch which continues as the spongy urethra in superficial perineal pouch. Next is the urogenital diaphragm is contributed by all except sphincter urethrae, perineal body, Colles fascia, perineal membrane. So the answer is the Colles fascia, because the urogenital diaphragm contains the deep perineal. It is a content of deep perineal pouch which is lined inferiorly by perineal membrane and not by Colles fascia. That thing to be noted. And Colles fascia lies in the floor inferior lining of the superficial perineal pouch. So Colles fascia is the inferior lining of the superficial perineal pouch. And urogenital diaphragm, it is like a triangular musculofacial diaphragm in the anterior aspect of the perineum and located in the deep perineal pouch. And it is contributed mainly by two muscles. One is sphincter urethrae and the deep transverse perineal muscles. So sphincter urethrae is also a component, and deep transverse perineal muscles inserts into the perineal body. So that is also a contribution to urogenital diaphragm. And these muscles are enclosed within the superior and inferior fascia. The inferior fascia is otherwise called as perineal membrane, and perineal body, we know it is a fibromuscular body attached at the posterior border of the perineal membrane in the midline. So both the fascia of urogenital diaphragm are attached to the perineal body, and perineal body is a good support of pelvic viscera and attached to numerous muscles of perineum, including the muscles of urogenital diaphragm, that is deep transverse perineum and sphincter urethrae. So this is a quite deeper explanation.